feces is of any use? What a bizarre question, you must be thinking. Now, you might find this repulsive, but would you ever eat it? What if your life depended on it? What if I told you that feces is not just toxic waste, but contains the secret to human health? First, answer this. Do you know about Clostridium infections? The bacterial disease afflicts 500,000 people in the US each year. About 29,000 of them die. It basically generates toxins in infected persons' bodies and ultimately destroys the lining of the gut. But now scientists have discovered a whole new way to fight this infection. It's called fecal microbiota transplant, or FMT. What is the procedure all about? Patients are given a fecal milkshake via a tube that passes through their nose to the stomach, or they take it in the form of a capsule, or should I say crapsule. And what does this concoction do really? Well, it restores the metabolism of bile, it blocks the bacteria's growth and controls the infectious disease. Scientists also suspect that it carries out bioremediation, that is, the fecal microorganisms break down and eliminate the toxins present in a patient's gut. Though it does sound disgusting, FMT is gaining a lot of traction. It is proving to be effective in multiple studies. It is also being investigated in hundreds of trials around the world and has been successful to varying degrees. And these, by the way, include trials for inflammatory bowel disease, irritable bowel syndrome, obesity, acute malnutrition, diabetes, arthritis, hepatic encephalopathy, liver transplants, skin cancer, autoimmune diseases, Alzheimer's, and other conditions, even bipolar disorder, hair loss, depression, and recurrent urinary tract infections. The method is yielding promising results, but the logistics cannot be underestimated. Fecal donors are difficult to find. Some studies use friends and families, others use staff members, volunteers, and even pooled samples taken from lots of donors mixed together. It is now an entire industry, in fact. Fecal transplants can be purchased frozen from biobanks. And then there are super donors. Their feces seem to contain some magical ingredient that makes it particularly effective. However, researchers don't quite understand why this happens. Donors are carefully screened for transmittable diseases or parasites. They undergo a rigorous screening questionnaire, medical interview and examination, and this is followed by blood and stool testing. Fecal samples are taken only when the donors are deemed fit. Sounds quite bizarre, does it not? FMT might be an alien concept for many of us today, but this medical practice is ancient. Feces has been drunk since the 4th century AD. The concoction is called yellow soup and treats infective diarrhea. In fact, in 1958, an innovative surgeon named Dr. Ben Eisenman also resorted to this method. He administered fecal enemas to his patients who had severe and recurrent Clostridium infections. Despite being remarkably effective, the procedure was largely ignored. Why was that? Maybe due to general aversion to feces. Scientists are just beginning to map out the microbial life in human bodies, and fecal transplantation is a critical tool for that. It is being used to cure multiple health disorders. In this backward world, human excrement is actually becoming a therapy. Who would have thought?